is Jara, and today I'll be assisting a patient or demonstrating you how you're going to be assisting a patient in ambulation using a cane. So for my procedure, I would like to first assess the patient and see if, just review the medical history or the medical records and see if there's any contraindication about this procedure that you're going to be doing with a patient, just for the safety of the patient as well, and just verify if this is okay with the patient to do. And then after that, you would like to assess on the lines that the patient has, if there's any IV lines attached to the patient, if there's any catheter or anything that would impede or be on the way with this procedure. So if you need to disconnect, you would need to disconnect. If you need to carry those equipments with them, just be on their side and assist them with this procedure while carrying those apparatus with you when you're ambulating. Let's say the catheter or something that cannot be detached from the patient. And then for my planning, of course, you would like to just make sure that the necessary assisting device or the cane or any device that you need or equipment, self-assisting equipment, will be used. And also you would like to eliminate any injury in this procedure. So just plan ahead and make sure that everything is set up for them and everything is okay to do with this procedure. And then for my implementation, of course, first I would like to wash my hands, do my hand hygiene technique, and then just make sure that if you need to, wear some PPE, then just wear it if needed. Otherwise, you can just, assist with, just washing your hands. And then just verify the patient's identification and date of birth. So for this, it's the name and the date of birth. So use your two identifiers in verifying the information. And then you would like to explain to the patient what you're going to be doing. Explain also that, just assess the situation, how far this patient is going to go, how far this patient is going to walk, if that's okay with them. Just make sure that if they feel dizzy or if there's any, out of balance with them, that they could just rest and then, take their time. Don't rush them into doing something like this, because sometimes patients are very weak and they don't have that strength to do this kind of procedure. So you would like to assess on that one if this is even okay to do with them. And then just encourage the patient to use the stand assist device or the self assist device that's available. If it's available for you, you could use those. Usually they could use those devices just so they could pull themselves up and were able to stand on their own. Just get those equipment if it's available. And then if the patient needs to have a gait belt, you would like to get that gait belt for them. Let's just pretend that this is my gait belt, and then you would like to wrap this gait belt around their waist. So let's just pretend that it's already wrapped, and then the patient will be seated down in their bed. So let's just pretend I'm the patient and I have the gait belt on me already. So I would let the patient be on the edge of the bed or the chair, whichever position they are into, and then just make sure that they're ready to stand up or get up when you have this gait belt. So this gait belt will be very useful for them to get up by you as a nurse pulling them up and using this. But make sure that you're in front of them when you're doing this procedure. That way they could easily hang on to you just in case they get out of balance. So let's say I'm the nurse, I'm the patient, and then there's a nurse that's gonna pull this gait belt for me. So I could get up. So you would like to give this cane to the patient on their stronger side of their leg. So let's just pretend I'm the patient and this is my stronger side of my leg, my right leg. I would give the cane on the right side. And then just make sure that the weight is evenly distributed on both of their feet when you're before they even ambulate. So just assist them and tell them that you would like to move the cane forward about 4 to 12 inches forward. And then you would like to follow through with your stronger leg a little bit over that over the cane. So let's just pretend that I've already advanced this about 4 inches or 5 inches forward. And then my right leg, which is the stronger leg, will be a little bit over the distance of my cane. And then you would follow through with your weaker leg parallel to the cane in your foot, on your stronger foot. And then do it again, about 4 inches, 5 inches, and then a little bit over that on your stronger leg, and then follow through with the weaker leg. So just make sure that the weight is always evenly distributed when the patient is ambulating with this procedure. And as a nurse, you would like to stand behind them or a little bit closer to them. That way, just in case they may fall or if they may lose their balance, you're there to support them just in case, even before you know, there's a potential for fall. So just assist them, be on their side once they're starting to ambulate. And then just continue to ambulate until you reach your desired destination with the patient. And then just make sure once they reach their desired destination, just make sure that you tell them that you can use their call light. They can use their call light just in case they need some assistance, just in case there's any, you know, like any needs that the patient may have. Just make sure that you know, you clean all the apparatus after you're done. If they use the assisted, the stand assist device, just clean that properly, and then just use your gloves, and then take off your gloves once you're done cleaning, and then just discard all your disposables in the proper receptacle, and then document all of this procedure with the patient and what time it is, and do your evaluation later and see if they're comfortable, if they're okay. Just assist them if they need to be repositioned with their bed or in their desired position or destination. So that will end my my return demonstration for assisting a client in ambulation using canes. Thank you and have a good day.